And somebody's put, Liz, you put a podcast idea in there. So
yeah, there's a really excellent podcast called Once Upon a Gene that features stories from rare disease families and researchers and advocates, very specifically focused on children with rare and complex diseases. Any other questions? I know that there was some discussion in the chat about social media in particular and how people have learned to moderate there. So definitely a thing that's just going to become more and more relevant to these conversations. Okay, well, I don't see any more questions, so I'm going to once again thank all of our panelists for being here today, for sharing their stories and expertise. And I am now going to turn it over to Jessica and Kasey to wrap things up. Thanks so much.
Thank you so much, Liz. This has been amazing. I just want to say thank you to all of the parents who have been with us today. It's been a long day, and I know most of you are taking care of your children just like I am. So it's been a constant, put a feeding in, change a diaper, but I've learned so much. And I also want to acknowledge Jennifer and Christina and Jorgelina, their children, Nora, Lena, Malachi, Benito, and Attilo. I love them. I love all of our Leigh syndrome children like they're my own. Since Will was diagnosed, I have come across 134 different SIRF1 families, and let's make it a mission to get more mutations of Leigh syndrome on board so we can figure this out. I hope that we have empowered and inspired you all today here. I know I'm not the closing remark, Jessica has it, but I do want to say a special shout out, or give a special shout out to Sophia for getting all of this organized and getting all the technical things ready. We couldn't have done this without you. You are a blessing beyond. You'll never know. And Miriam is so lucky that you are fighting in her honor. So thank you. My heart is so full, and I'm going to hand it over to Jessica. Thank you all.
Thank you, Kasey. So it's my honor to have the closing remarks, and I thought I would just hit a couple highlights and take home points from today's many really great talks from not only scientists and physicians, but also hearing from pharma companies and about clinical trials, and most especially the parents of children that are affected by Leigh syndrome. So as we started our day today, it's been 70 years since the first description of Leigh syndrome, and we've come a really long way. And there are still many challenges and barriers that we face, but we've also made a lot of important discoveries in the science. We have new preclinical models, including mice, the NDUFS4 mouse that really well recapitulates many of the hallmarks of Leigh syndrome. And we have new cell models and induced pluripotent stem cells that can be directed to differentiate into different cell types, including neurons and cardiomyocytes, that are opening up our ability to identify new drug targets and perform drug screening. In addition, we've also had many challenges in doing clinical trials for the new therapies for the treatment of Leigh syndrome, but that's also starting to see movement with pharma companies becoming less risk adverse, as well as several new drugs that are currently in the pipeline going through the phases of clinical trials and showing a lot of promise, particularly some of the antioxidants that were discussed today. And so one of the things that I think is really going to help move us even further is also the fact that the organization like Cure Mito has really identified two really important barriers to the movement of clinical trials. And one of those is creating a registry of patients in order to connect the patients and families with researchers and with clinical trialists to help move along the science and identification and safety and efficacy of new drugs. In addition to that, the registry and the surveys that the Cure Mito Foundation is doing will help us understand the natural history of these diseases, to understand the progression, and to better design clinical trials, to better identify those therapies that are going to be most effective in improving the outcomes of patients living with this disease. And I think I want to leave you all today with how we started. Kasey started us off highlighting the fact that we all need the community to come together if we're going to identify drug therapies and better improve the lives of these patients. And so I think this really requires us to come together, not only patients and families, but physicians, pharma companies, and scientists. And I think Kasey and Sophia really effectively did that with our symposium today. And I would just like to thank them and all of the leadership at Cure Mito for hosting this really great event. And may this be the first of many. Looking forward to seeing you all soon. Have a good rest of your day.